Hi, I'm Dr. Ron Miller of Pursuit Physiotherapy, and today we're going to go over in running and running injuries why cortisone injections and pain medication is not a long-term solution for your injury. Us as athletes, runners, we're always looking for that quick fix, but pain medications and injections are not the solution towards long-term outcomes and for running injuries. For one, there's some sort of root cause or risk factor that is predisposing you to get this injury. And again, if you follow some of my previous work, these injuries occur because of three main things: either a training error, a biomechanical flaw, or a structural issue. And that's the root cause of why you're experiencing your running injury. Pain is just the effect, and there's a true cause to it that is causing you to have your pain. If you just chase your pain by taking a pain medication or running or rushing to get a cortisone injection, yes, it blocks the pain, but you still have these underlying impairments here. And the goal isn't a quick fix when you're dealing with a running injury. The goal is to get a long-term outcome, get pain-free again, and back to running. If you're just having pain, taking a pain pill, but then your pain comes back the next week or when you return to run, you're missing the root cause. Or if you get this pain and you get an injection and your pain's gone, but it comes right back the next week whenever the injection wears off, you're just chasing symptoms and chasing pain, and you're not solving the root cause of this. So the main thing, the first point, is to solve the root cause of your pain. The second thing is runners should not be taking NSAIDs. An NSAID is a non-steroidal anti-inflammatory medication like ibuprofen, Aleve, and stuff like that. There's a lot of, you should not be relying on pain meds or anti-inflammatory medication and still running. There's a lot of negative side effects, not just because you're blocking the pain, but there's also some studies that showed there's gastrointestinal involvement too, and people who chronically rely on these NSAIDs and just keep on running through the pain or blocking the pain and running, but they're still aggravating the injury. It's kind of like saying you're a football player, you have a herniated disc, you go and get an injection and you don't feel the pain. Now you go back out and start playing again, but you still have the herniated disc. So you don't feel it, but you're probably going to make it worse. So the same principle applies. You could have knee pain, you have a true cause of the knee pain, and you're just taking some NSAIDs or anti-inflammatory meds blocking the pain, but you're just going out and running on it, making your injury worse a lot of times. So one thing is that I want to get across to my runners out there is taking NSAIDs, pain medication, or relying on cortisone injections is not a viable long-term solution to your running injury. And you really have to focus on solving the root cause of why you're experiencing that, or your injury, or your pain. And once you solve that, you'll get the long-term results and get back to running and get back to your training. So let me know if you have any questions about this. Solving the root cause of your running injury is the key here, and not relying on some medication or injections. So please like the YouTube channel. We have a running injury playlist specifically for runners and running injury prevention. We also have a closed Facebook group for my Orlando runners called Orlando Runners Therapy. Please subscribe and like that page. And I just want to say thank you for tuning in, and until next time.